Perfect.
So we will now take questions. So if you have any questions for Jodi or myself, you can drop those in the chat box, and we will take questions as we go. Or if you have some comments that you'd like to share, we will take those too.
Yeah, observations would be great as well, just about your own experiences.
Yeah, absolutely. So Jodi, while we're waiting for questions to come in, one of the things which I keep thinking about each time we talk about data, and you alluded to this earlier, which is that we sometimes have all this information, and then how we collect it may be problematic, what we do with it even more so. And so in a sense, like data itself can be very dehumanizing, and it can be used to actually further marginalize communities because it's not neutral. So in terms of data governance, like what has been your experience in that? Like ways to avoid that?
Ways to avoid it. Well, I guess in a way the policy area I work in is rife with examples of that.
Mm-hmm.
Just because it is indigenous, the governance sort of the indigenous-crown relationship, and there have been so many examples, not only of research projects, but just like administrative data where you take, when you think about it, the Indian registry itself, it's going into the Indian registry are people who are Cree people, they're Mi'kmaq, they're Haida, they're from all parts of, they're from tribes from all parts of the country, and then through the administration of, an Indian number, like registering them, then they come out on the other side, sort of, Indians with a number, and something that's a foreign attribution to them, but it's their legal status now, their status Indian. So that in itself would be a prime example, I think, of the way in which data creation, data collection, data use, data administration can really have an impact on even the very identity of a group of people. And even when you're thinking about population statistics and population health, there's always a little bit of a danger that it's inherently dehumanizing in a way, right? Because it's talking about full populations. But that gets maybe a bit too philosophical. Ways to prevent that experience has been precisely what the OCAP principles demand, and that is there's no research that's done like about us without us. And that's it's a very simple formulation, but when you think about it in practice, it sort of turns the research relationship on its head. Because even to the point of, casting a project, is this relevant to us? I mean, you'll have, this was part of the issue, I think, with the First Nations Health Authority, was they wanted to ensure that these health indicators that were developed for the people, the First Nations people in BC, actually spoke to what First Nations people in BC saw as healthy indicators of health according to their cultures. So that's an example of how they dealt with it. They're still dealing with it. They developed jointly indicators through their tripartite agreement of First Nations health that would then be measured, and the data collected would be based on that. So there's one big example I can think of. We do have one comment too.
Thanks for that, Jodi. So the other question there is around data governance. So Kellen is saying data governance is often managed through research ethics boards, at least in research, and that structure itself has a long colonial and harmful history. Do you know of any case when an organization addressed those issues embedded in research ethics boards?
In the boards themselves, I'm not certain of cases of that. I'm not at a university, so I'm not certain of cases where an organization has taken on like the issues in the research ethics boards, but I do know that the First Nations organizations require their own protocols and their own ethics reviews as an alternative. So it's not enough, for example, in Alberta, if you're working there, there's an Alberta Information Governance Center there, and they will, if there's a project that's to be contemplated, and it could well have been approved by the ethics board of the university, but it doesn't mean that people can go into a community and do research unless that community has consented to it. So there's an example, I would think. I don't know of literature in particular that's taken that on, but I could find that for you too and get it to you.
Yeah, great, thanks. I think, yeah, I'm not sure about research ethics boards specifically, but I've seen similar things in the Ontario context where I know researchers who are actively seeking approval from band and council. So doing that work to directly engage various First Nations and get that approval before anything happens, and making sure that's an ongoing part of the process. But that's
right. And I think it does go beyond to, there's a tri-council policy statement on the kinds of research protocols that should be undertaken when dealing with Indigenous groups, and I think other vulnerable populations as well, right? I'll let the First Nations group speak on, for themselves on their positions on this, but from what I understand, it does not represent per se what the OCAP principles would require.
Mm-hmm.
So there's an alternative, an additional.
Thank you. And do we have any more questions or comments? Just going to continue paying attention to the chat box there. So if you do, please send those in. Okay. So we're just taking questions and comments. So as we wait for some of those to come in, I thought we'd just share some. I think we've covered a number of different issues related to governing for health equity. We just heard from Jodi, and she spoke particularly on data governance, and I spoke to some other things related to community participation and strategic intersectoral action. So I think for us all, we can start to think about within the context within which we work, who gets to make decisions about public health activities, and specifically more around activities related to health equity and the social terms of health, and how are those decisions being made? I think the question of accountability keeps coming up. So how do we ensure that the decisions being made we're actually accountable to the public and to communities in those decisions, and our marginalized communities actively engage. And I think some of the examples we're sharing are really about, and I love what you just said there, Jodi, about turning certain relationships on their heads, right? So really rethinking that and moving to this piece which is closer to full and genuine participation and community control. So we'll leave you with some of those reflection questions. And thanks to all the resources which are being shared in there. So Jodi, before we wrap up, I just wanted to give you an opportunity if you had any final thoughts for our participants today.
Well, I had actually a question for you too, Sume, and that's as you were looking at health equity, in governance, and is this because it's just part of your model overall that you want to address like each and every sort of sector of health equity and what's involved, or was there a particular purpose, I guess, that brought you to this module and introducing it?
Well, great question. So I see there's some members who've been working within the Learning Circle I mentioned earlier. So when we started this book about, I'd say, a year or so ago, we started thinking about, okay, if you're an organization and you're trying to take health equity seriously, what do you need to be paying attention to within how your organization functions? And so working with our partners who are part of the Learning Circle, as well as 2 public health organizations, we're really going back and forth to say, okay, what are some issues which we should be exploring? So we know that we don't have the time to go through every single thing which is of relevance, but we really wanted to make sure that we were tackling some questions which we think are relevant to the field. And so that's really how we landed on the question of governance. And so it keeps, as we do that, it keeps taking us to different places. So when we started that conversation, we weren't really thinking we were going to explore data governance specifically, but one of the organizations we're working with, their project is actually looking at how do you integrate sort of an equity lens into reporting around the opiate overdose crisis. So we knew that for them, use around data would be very interesting. So we dug a bit deeper into that. So that's sort of, we've been really using this sort of emergent approach where we go where people are interested in going. And so then we try and answer those questions. And the perfect example is that when we asked the data governance question, we started to ask about, we started doing searches around Indigenous data governance specifically, which then led us to some of this work which you have spoken to today, which for us an opportunity then to explore a little bit deeper in partnership, obviously, with the folks actually doing this work and living this experience.
Right, which I think would be a great, I mean, if I had a final thought on this, I think a great next step would be like to do, you've been in touch with the Tweak in Partnership, but just to talk to some of the organizations that have undertaken this and some of the challenges that they've had and they've had to work through when they work with governments in particular in data sharing. Some of the rewards, and then also it seems to me, I mean, there are certain things, there are certain ways in which First Nations people and Indigenous people generally in Canada are unique, but there are other ways where what they've done would be potentially applicable across, I mean, like the OCAP